start playing it and then just go where your mind takes you.
Oh, that's a dangerous place. A once viral game called Wordle has now become medically transitioned into Doctordle. Terrible name, but let's see how much medicine I actually know. Let's get started. Beep whoop. 42-year-old woman presents for premenstrual breast pain. This is like, it's asking me to be Gary Brecka right now. It's asking me to make a diagnosis of just that. Okay, so we're gonna say physiologic.
So this is where you might run into trouble. There's like predetermined options.
So this is interesting. The problem is all of these are pathologic and they're all pretty serious. I mean, it's not that it's not serious, it's that I need to know more before I start making a diagnosis of something serious.
That's not how Doctordle works.
But that's not how medicine should work. There should be like a updated version of this. Oh my God, like malingering. Yeah, she's faking.
Okay, let's go.
Okay, so most likely diagnosis in a 12-year-old boy with rough raised lesions. I would say wart. Verruca vulgaris. Oh.
Nailed it.
Okay.
Real doctor over here.
Warts caused by viruses. We usually freeze them off in our office. There are some over-the-counter treatments, usually not as good. Need multiple treatments a lot of times in order to get them fully out. But otherwise, pretty benign. A 42-year-old woman presents to her primary care physician with complaints of poor sleep and difficulty concentrating at work. Okay, guess where I'm going? Damn. She attributes her symptoms to just stress and avoids discussing specific triggers. Poor sleep usually doesn't happen as a result of just stress. So let's say generalized anxiety disorder. No. On further questioning, she admits to frequent nightmares and feeling on edge. Whoa, this is getting interesting. This is where my investigative mind goes to. I'm like, ooh, she's having frequent nightmares because she's taking Benadryl. And because she's taking Benadryl so often, she's having decreased concentration at work because she's feeling sleepier from the Benadryl. Is it just depression? No. She recently declined a promotion that would have required air travel, citing discomfort with airports and crowds. Agoraphobia? No. She becomes visibly tense when asked about a car accident she survived 3 years ago and mentions that avoiding that part of town. Is it post-traumatic stress disorder? Yeah! I mean, that's not how I would have presented it, but man, you gotta go. That's interesting. A newborn is assessed in the hospital for cyanosis and tachypnea. How new is this newborn? God, there's like, I would think they would reach for something crazy, like tetralogy of Fallot. Nope. Supplemental oxygen does not improve symptoms. Transposition of the great vessels. Look at that, baby!
Yo.
Look at that!
Yo.
Ah! And they ask me why I'm keynoting the American Academy of Pediatrics conference at the end of this year.
Let them know.
Come on, that's a hard one.
That was impressive.
Okay, the first one is true though. A newborn cyanosis tachypnea is tetralogy of Fallot, or transposition of the great vessels. A 40-year-old man presents with white patches on the side of his tongue. They're probably gonna want me to say thrush, but I don't think it's thrush. I think that they're gonna say that it's not scrapable, which means it's leukoplakia.
Oral leukoplakia?
Oral candidiasis. Wow. What about the other leukoplakia that I had?
Do it! Just do it!
I don't think it's leukoplakia because it's not.
Do it!
What's the other one? Oh, are you kidding me? Is it chronic mucocutaneous candidiasis? Oh no. Physical exams, feathery white plaques, lateral borders of the tongue. The plaques cannot be removed. God, is it hairy? It might be that hairy one. Hairy leukoplakia. My first guess was right. Yo, how crazy is that? It wasn't oral leukoplakia, it was hairy leukoplakia. That's why with no shame, I would use up to date in a scenario like this or my dermatological textbook. A 30-year-old woman presents with vaginal discharge and itching. Okay, that would be yeast infection until proven otherwise. So vulvovaginal candidiasis. She is sexually active with 2 partners and they use condoms inconsistently. She reports her partners have no symptoms. Okay. Bacterial vaginosis. Gonorrhea. Chlamydia. Trick. Why am I missing trick? I shouldn't be missing trick.
What happened there?
Because all of these would be tested for. So it's like, you don't just say, oh, is it this one? Is it this one? Is it this one? And you keep sending the poor patient back for 10 tests. A 30-year-old man presents with fevers, muscle pains, and chills for the past 3 days. I mean, like influenza, right? Let's just go influenza. He reports that he experienced similar symptoms lasting a week a few days ago. That doesn't make sense. Let's skip again. He recently returned from a Humerian trip. He has malaria! Malaria! Oh my God, there's 3 different types of malaria. Oh my God, babyosis? No, oh my God. He denies tick exposure, but there's an outbreak of lice. Typhus, Borrelia recurrentis. Bro, never heard of you in my life. Never heard of you in my life. A 30-year-old man presents with 3 days of fever, abdominal pain, and diarrhea. That's really broad. You could be anything with this. Let's go with the salmonella gastroenteritis. He reports that the symptoms started a day after attacking barbecue. Let's call it norovirus for now. I doubt it's norovirus though. No. He reports that diarrhea is initially watery but blood tinged. I feel like it's salmonella. I'm gonna go E. coli. No. He recalls eating low temperature smoked chicken recipe in which the meat near the bone appeared undercooked. Campylobacter? Campylobacter, here we go. Yeah! The most common bacteria that you get sick from. Salmonella, Campylobacter, E. coli. That's why I went with all of these. I thought norovirus would be a distractor, which it ended up being. A 40-year-old man presents with rhinitis and multiple asthma exacerbations requiring systemic corticosteroids and hospitalizations over the year. I know what they're going for. They're going for some like IgA, selective IgA deficiency. No, he reports no history of asthma as a child. So he randomly has asthma now. Let's see if it's a COPD diagnosis. No, he reports new onset foot drop as well as frequent bouts of nausea and vomiting. Oh my goodness. So he's having some sort of loss of control over his neurosystem, but why rhinitis? Oh wait. Cystic fibrosis. Physical exam reveals rhinitis, nasal polyps, and palpable purpura. Oh my goodness. This feels like straight a boards question. Is it like Berger's disease? Eosinophilia and positive P. ANCA with normal platelets. I'm gonna go lupus just because sometimes you always have to think about lupus. It's never lupus. A lung biopsy shows granulomatous inflammation with eosinophilic infiltration. The nasal polyps is definitely some sort of giveaway. Churg-Strauss syndrome. Yeah!
Yo, we got there.
Small to medium vessel necrotizing vasculitis. Eosinophilia, asthma, granuloma. Look at that, T-cell, B-cell activation. A 22-year-old presents with right hand pain and swelling that began earlier today. Pain that started earlier today in the hand. You know what? This is a good one to skip because I don't know. He reports sudden onset of pain when his hand struck the wall during racquetball. Ooh, boxer's fracture? Bro, call me Kobe! A 63-year-old woman presents with acute chest pain and shortness of breath that began shortly after her boyfriend ended the relationship. Takusobu! Yeah, that's that broken heart syndrome. Yeah, so patients like this, they start having elevations in their cardiac enzymes. They end up going into the cath lab because they think that there's a blockage, and they actually have no blockages, and it was temporary. Don't break up with your boyfriend or loved one on Valentine's Day. A 22-year-old woman presents with a several-month history of voice changes. That rules out anything infectious because anything infectious wouldn't be several months, otherwise there'd be an issue. But let's go based on the age, vocal cord polyp.
All right, now, you know what? Now you got it.
Yeah! A 34-year-old woman presents with a 6-week history of crampy lower abdominal pain, intermittent loose stools, sometimes with visible mucus. Oh, okay, so this is some kind of fat malabsorption. Let's go with celiac. She returned 8 weeks ago from a 3-month volunteer placement in rural Guatemala where she reports drinking untreated well water on several occasions, eating street food regularly. I don't think it's one of these acute ones. It's some kind of parasite. Let's say tapeworm. On closer questioning, she says bloody diarrhea. Hookworm. Stool microscopy reveals motile trophocytes containing ingested red blood cells, and colonoscopy shows scattered flask-shaped mucosal ulcerations. Leptospirosis. No. Right upper quadrant ultrasound is performed to investigate a dull aching sensation she mentions, revealing a 5-centimeter hypoechoic lesions in the right hepatic lobe. It's some kind of friggin' protozoan, and I can't put my finger on it. Shigella. She started on metronidazole, followed by a luminal agent. Her symptoms resolve. It's some kind of worm. Trichinosis. This is my best guess. Nope. Entamoeba histolytica. That's a good one. It's a pathologic protozoan. I said it's a protozoa of some sort. I said it like 100 times, but we just don't see this here. A 58-year-old man presents to the emergency department with nausea and chest pain that began when eating Thanksgiving dinner. All right, we're gonna have to assume heart attack. He has a history of hypertension, high risk, hyperlipidemia, high cholesterol, high risk, 30-pack year smoking history, very high risk. Let's say non-ST elevation, MI. Physical exam reveals diaphoresis and mild tachycardia, so he has a fast heart rate and he's sweating. These are not very valuable. I mean, are they really going for dissecting aortic dissection? Like, that's aggressive. Nope. ECG shows diffuse ST depression. I mean, if it was elevations, I would say like maybe myocarditis. Pulmonary embolism? Serial troponins are negative. So he's not having a heart attack. He's not having a pulmonary embolism, but he's having nausea and he's having chest pain. Oh my God, is this some kind of like lung cancer presenting tumor? Small cell carcinoma. The patient reports that the pain occurs with both exertion and at rest and has been increasing in frequency over the past week. He said it happened during Thanksgiving dinner. Oh, unstable angina. Oh my God, this is so embarrassing. Yeah, I should have gotten that. My bad. A 45-year-old man presents to the emergency department with fever, chills, headache, painful groin swelling, and weakness. Okay, I'm gonna say prostatitis. Wrong. He recently returned from a camping trip in New Mexico where he slept without a tent for multiple days. Jesus. Oh, they're gonna say it's some kind of bug bite. Blastomycosis. No, on physical exam, there are full lymph nodes in the England region demonstrate overlying warmth tenderness. Yeah, I know. Something that bit him. What bites in Mexico? Coccidiomycosis? No. Leukocytes. Okay, is it white count? He doesn't have a lot of platelets. God, what is it? Over the next 3 days, the buboes come out and become suppurative. Oh my God, are you gonna say it's the bubonic plague? It's the bubonic plague!
Oh, that's the best.
I mean, how was I supposed to? Bubonic plague,
You ever
man.
see that in the clinic?
Yeah, last week. 4-year-old man presents with pain and swelling over his right knee. 4-year-old is a bit young for OA. Let's go rheumatoid arthritis, even though it's not the most likely cause. He denies instability or limited range of motion. Okay, so pain and swelling over his right knee. If he doesn't have instability, we know that there's no tears of anything. There's no limitations in range of motion, which is good. Prepatellar bursitis. Look at that! 2 guesses. A 26-year-old man presents with crampy abdominal pain and bloody diarrhea for several months. I'm going ulcerative colitis until proven otherwise.
And that's it. That's it.
How about reacting to some of the world's rarest diseases? Click here to check that out, and as always, stay happy and healthy.